Welcome to our forum tonight. I think it's number 15, maybe. Ashley, is that right?
I think that is correct, Hector.
Yeah, so this is our 15th forum, which is, how we're trying to be able to provide programs that, get to you by any means necessary, knowing what, we're all going through. But so tonight's forum, it's private insurance, navigating your access to care. For those of you who don't know me, my name is Hector Garcia. I'm the Executive Vice President of Programs and Services. And I am fortunate enough to be able to, be with you tonight. I have enjoyed every single forum and every opportunity that I've had, to be able to share with you, get to know you better, and continue to developing new programming to serve you better. To our return attendees, which I've seen at least 7 or 8, welcome back. It's always great to see you again. I think we might have one person from Puerto Rico, and if that's the case, hola. I am glad you're joining us. And for our new participants, welcome. Hopefully, this will meet your expectations. It's my sincere hope that you will enjoy tonight and that you will join us again for our forums in the future. We have a very, I'm going to say, important forum coming up on July 23rd at 7 p.m. and you will receive your invitations. We'll have a national forum to update you on the evolving situation with COVID-19. As we look at, everything that it's, I'm going to say, flaring up, different hotspots, throughout the country, new symptoms being reported, and an update on vaccines. So that it's July 23rd at 7 p.m. and that'll be a national forum. So we will invite the entire country for that. So I hope you're available and you can join us. I also want to welcome our sponsors, which you will hear from them later tonight. Also want to remind you that some of our sponsors have plasma centers throughout the country, and if you have friends or family members that at some point in time are able to donate plasma or are already plasma donors, that's a great way to support our PI community. With that, I am going to turn this over to Ashley Ferreira, who will be your host for tonight's forum. Ashley?
Thank you, Hector. Although I have to admit, I was a little disappointed you didn't roll your R with my last name.
All right, let me repeat that again. Ashley Ferreira.
Thank you. I'm gonna be honest with you all. He probably says my last name better than even I do. Thank you, Hector. So as Hector indicated, welcome on behalf of the Immune Deficiency Foundation. It is always great to see you at these forums. We are always excited to welcome back our old participants. For our new participants, thank you for coming here. All of our forums are created for you, to serve you. As you can see from our mission, IDF is dedicated to making sure that our community is empowered, that they have the tools that they need with advocacy, education, and research in order to be the best advocates for themselves, so that they have the information that they need throughout their journey. IDF is with you every step of the way. And so we put together these forums, again, so that you have those resources, those tools, that was vital information, especially during these challenging times. We want you to remember IDF is committed to our community, serving you as a trusted resource. We're here to give you all of the tools and information you need, but most importantly, we're here to offer you our compassion, our understanding and support, to emphasize that you're not alone on your journey. We are here for you. At this time, I would like to thank our sponsors for this event. It's through their support that we are able to put on all of these wonderful programs. Our core service leader, CSL Behring, Grifols, and Takeda. Our core service supporter, Octa Pharma. We also have our core service sustainer, Horizon Therapeutics. Our core service contributor, Leadiant Biosciences. Our national sustainer, Accredo. And our national patrons, Diplomat Specialty Infusions, Kedrion Biopharma, CVS Specialty Quorum, CVS Specialty Infusion Services, and Koru Medical Systems and Kava Fusion. So at this time, I would like to invite Sean McCabe from Takeda for a quick word from our sponsors.
Ashley Ferreira, sorry. Did my best. Hector, I can't hold a candle to what you just did. Sean McCabe, I have the honor and the privilege of leading the immune deficiency franchise at Takeda. And if you don't know Takeda, relatively new name, but certainly the lineage is there. So this is from Baxter to Baxalta to Shire to Takeda. If you don't know us by the manufacturing name, we are the proud manufacturers of GammaGuard, HyQvia, and Cuvitru. As much as our name has changed, our commitment certainly hasn't to not only our therapies, but this community. And so with that, I want to thank, and I do it every time, the IDF for stepping up in the moment and creating these forums with very apropos insights and information for the community itself. We are very proud to represent multiple therapies and support multiple patient communities at Takeda. But by far, this organization has stepped up in the moment and allowed for these, not only these virtual settings, but stayed engaged with their community more than anything we've seen. So it's just an honor and a privilege to remain a part of this, and thank you for that. I'm joined tonight by my colleagues, Dana Flathammer, who leads our community support team. I also saw Joanne DeVries, who's part of our patient services organization, and then one of our ambassadors, Mary, who will be mostly listening mode. But we'll be here throughout the breakouts. And I just want to say this is our opportunity to listen. This is where and how we do it. So please let us know how else we could better serve as manufacturers in this space and along your journey. So thank you again, everyone, and looking forward to the forum.
As always, thank you so much, Sean. We always enjoy hearing from you. And without further ado, I'd now like to hand it over to my colleague, Nichole Clark. Nichole Clark is IDF's Associate Director of Patient Advocacy. She has been with IDF for, I want to say 9 years, if not a little bit longer. And I'm going to let her finish introducing herself to you.
Thank you very much, Ashley. And yes, actually, next month will be 9 years of my time here at IDF. It has been quite a journey. It's been very fulfilling, and it's been an honor to have been a part of IDF and a part of this community. My background in advocacy and insurance work, and working behind the scenes with public policy to make sure that our patients have access to care. There's a lot of behind the scenes work that's always done at IDF. First, while tonight's forum is not a COVID-specific forum, I do want to say that IDF understands these are tough times, and our goal for tonight is to inform you of your options, and we hope that it will answer some of your questions when it comes to insurance, obtaining an insurance plan and programs that are available to help you with that. IDF is here for you. There's other organizations. Many of the manufacturers have expanded their assistance programs to help those who have been affected by COVID. So if you have had a loss of job or loss of insurance, NORD is the national organization for rare diseases, and they have created their COVID-19 critical relief program. It is a grant for individuals who have been impacted by COVID and can help with medical costs. The manufacturers also have compassionate care programs. So if you're on a product, you definitely want to get in touch with them, their patient support, and to see how they may be able to help you. So this evening, we're going to be talking about private insurance plans. We're not going to be going over government, Medicare, or Medicaid. This is strictly private health plans that are purchased either through the Affordable Care Act, the state marketplace, or policies that you may purchase through a broker or agent, or employer-sponsored plans. So the biggest thing that I want to remind everybody, because this has been an ongoing topic for some time, since probably about 4 years ago, the day after the election, when I started getting many calls and hearing people wondering if, you know, the ACA was going to be overturned and if any of these protections were going away. As of today, the ACA remains in effect. I can't guarantee what may happen in the future, but all of the protections that were in place through the Affordable Care Act remain in effect. You cannot be denied a health plan due to a pre-existing condition. There are no out-of-pocket costs for certain preventative services. There are no annual or lifetime caps on a health plan, which is a huge relief for somebody with a chronic illness that requires an expensive life-saving treatment. There's out-of-pocket maximums, and there's dependent coverage to age 26. For the dependents, it does not matter whether they're in school. They don't have to live with you. You don't have to claim them on their taxes. They can even get married, but fortunately you won't have to pay for their spouse, but they can stay on your plan until the age of 26. So first we're going to go over health plans in the marketplace. You can go to healthcare.gov. You can search by your state, and you will start to fill out some information, and you will see the plans that are offered to you based on your location. All of these plans cover the same benefits, and they have the same out-of-pocket annual maximums. The biggest difference is the cost sharing. You can see what the maximums are for this year, and next year they do go up a little bit. They have steadily over the years. But when you're looking, you know, at these plans and considering costs, the lower level plans like your bronze or silver, they're going to be your lower premium plans, but they typically have a much higher cost. There's typically a 30, maybe 40% coinsurance. So when considering all of your healthcare needs, but particularly if you're on immunoglobulin, 30 to 40% is almost unaffordable for many. So for those who have rare diseases that require an ongoing treatment, most people do much better looking at the gold or platinum plan. Your premium may be a little bit higher, but it's still going to be a cost savings to you when it comes out of pocket cost. Also, there are subsidies. When you go to apply for a plan in the marketplace, they will ask you financial information, and they will automatically check to see if you even qualify for Medicaid in your state. If you qualify for Medicaid, they will not allow you to purchase a plan. If you don't qualify for Medicaid, you may qualify for a premium subsidy. So you may go with a platinum plan, but end up getting a break on that premium cost. So other options to shop outside of the marketplace is going to be going to an insurer directly. A lot of times you can go right to their website, you can put in your address, they will show you the plans that are available to you. You can work with an agent or a broker. An agent works for a single health plan. So they may have different plan options, but you're going to be looking at one insurance company, where brokers sell plans from a number of different companies. There's also many web-based brokerages now online, so you can also search that way. A lot of people like to check out these private plans outside of the marketplace, because we've heard over the years in different locations that some of the plan offerings have diminished. You know, it used to be where you may be able to go to your state's marketplace and have 6 different, you know, options to choose from. And in some states, sometimes they log on and they really only have 1 or 2. So this is another option when it comes to looking to purchase privately. Now, most people are fortunate to obtain their coverage through employer-sponsored coverage, and the plans that are offered definitely vary. The benefit coverage is all about the plan design. I often get the question, what company should I go with? Should I go with this company or should I go with them? Who's better? And it's not necessarily the insurance company, but it's the plan design and the coverage that is provided in that plan. With employer plans, the ACA applies the same. So they have those out-of-pocket maximum amounts, preventative coverage and such. And many employers can choose to have an out-of-pocket maximum lower than what the annual amount that is dictated. And the other thing that's really important to consider when you're looking at employer-sponsored plans and people are trying to figure out what their costs are going to be, a lot of times there's different entities that are administering your coverage. So you may have a pharmacy benefit manager that administers pharmacy benefits, and you have a different entity that's, managing your medical benefit and your dental benefit. But you want to know if that dental, for example, or that vision plan, is that part of your medical plan? If that is part of your medical plan, and you have different, let's say, deductible amounts. You could have a $2,000 deductible in your medical plan, and maybe you have a $100 deductible for dental. All of those are incorporated and included in that total out-of-pocket maximum that is indicated on the policy by your employer. So it should not be separate or in addition to, they all contribute to that. So whichever route you're using to purchase a plan, you have to know that every plan is different. And it is going to take some investigative work, whether you really want to do it or not. But there's a lot of information that you need to get answers to in order for you to make the best informed decision when choosing a plan. And it's looking at those coverage details and how to accurately compare what your options are to figure out what's going to work best for you. So what are the main things that you want to look for when you're shopping for your health plan? As I've said, and very important, what is your out-of-pocket maximum? That amount is, once you have paid out of pocket that amount, everything is covered at 100% for the remainder of the year. Some people reach their out-of-pocket maximum, some never do. But that number is there so that you only have to pay a specified amount, and then you have 100% coverage. You want to know about your deductible. And is your deductible included in that out-of-pocket maximum? Most cases, it is. But for example, I spoke to a patient probably a year or two ago who had contacted me and said, well, I have this plan and my out-of-pocket maximum is $4,000 and I've paid $4,000, but they're still telling me I owe $6,000. She had a $2,000 deductible and she had a $4,000 out-of-pocket max, yet her total out-of-pocket costs were $6,000, and that $6,000 was below the annual limit. So she was just taken aback by that. Like I said, most of the time the deductibles are included, but that just may be something that you want to verify. Another important thing is, how is your immunoglobulin covered? Is it covered under your medical benefit, or is it covered under your pharmacy benefit? You may have different deductible amounts for your pharmacy versus your medical. So that's going to help you gauge what your true out-of-pocket costs are going to be. Also, does your plan offer coinsurance or copay? Do you have to, do you have an 80-20 plan and all of your medical needs require a 20% coinsurance, or do you just have a flat copay amount? Coinsurance can be much more costly out of pocket versus a flat copay. And the other thing to look at as well is a lot of these costs, the copay amounts, sometimes your visits don't apply to the deductible. You may have a $2,000 deductible, but it only applies to certain services. So you may be able to go to your PCP or go to a specialist that's in your network and you just have a flat copay, and that amount does not go to the deductible amount. The other thing to consider are your options for site of care. If you do IVIG, or do you have to go to an outpatient infusion center? Are you allowed to go in your doctor's office if they have a small infusion suite? Are you allowed to have home IVIG? You want to know what your benefit options are, especially if you're already established at home and you're looking at a plan that says that you're not allowed to have home IVIG. And you want to look at your network. Most importantly, you want to stick with the providers that are in your network. Even if you're allowed and your plan has out-of-network coverage, the out-of-network benefits do not apply to your out-of-pocket costs, out-of-pocket maximum. So if you're with an immunologist, you have a new health plan, he's not in that network, you choose to stay with him, one, your out-of-pocket costs are going to be higher with that out-of-network benefit. But all of those visits, and even possibly because he's your ordering physician for IG, it's all considered out of network and it will not apply to your out-of-pocket maximum. So you may never reach that amount, even though you are paying a little bit more for that benefit. So what else do you need to know regarding benefits? You want to know if you have, do you need a referral to a specialist, or are you allowed to just go see your specialist freely? What services require prior authorization? Any service, especially immunoglobulin, is always going to require a prior authorization. I don't care what someone says, whether it's a specialty pharmacy that says, oh, we have everything together, we're shipping it out. Make sure that prior authorization is in place before you infuse. I have talked to people who said, well, they said everything would be fine and they had the documentation, but they didn't actually have the prior auth on file at time of infusion. And while you can fight that and get the approval, it's going to be much harder to work with the insurance company and asking them to backdate an authorization. And there may be many other benefits that require prior authorization. So it's good to know what services do have that requirement. A newer thing, when it comes to IG therapy, there are many insurers that are using a restrictive formulary. They call it the least cost medically necessary brands. And if you are on a product and have been established and you choose a plan and that product's not in the formulary, it could be hard trying to get approval for you to remain on that product. It's important to know, if you have, typically when you have the restrictive formularies, let me go back a second. Typically they'll give you 3 or 4 options for an IG product, and then there's 2 for subcutaneous. If you have been on any of those products in the past and you've failed, meaning you've had adverse reactions, it wasn't working for you, any of that documentation will help you to request the product that's being ordered by your physician, but also as proof of, I've already failed this is why we're requesting this. Unfortunately, it's a little bit harder for those that are initiating IG therapy. I've talked to some patients who are just starting out and their doctor wants them to be on a certain product, but they haven't been on anything in the past, and it's much harder to get that approved. So that is something that you want to know, but particularly for those who have already, kind of made changes and have been on different products in the past. Another important thing is, does your health plan offer case management to assist with navigation of benefits? I mean, most insurance companies do have nurse case managers. You can call and request one. They help with coordinating your benefits, and if you're having an issue, they can assist you appropriately in kind of navigating the path to a resolution. So it's an added perk to most health plans. So as we talk about all of this information and what you need to know, we do have this information on our website. If you go to primaryimmune.org, there are a bunch of tabs at the top, and one of them is called Living with PI. You can scroll down that tab, and there is the Patient Insurance Center, where we have information that we're discussing this evening about how to choose a plan. There's actual comparison worksheets that you can print out. So if you want to write everything down and look at it side by side to really, figure out what's going to work best for you. And then there's information on appealing denials, and there's contact information on the manufacturers and all their patient support programs. So once you've decided on a plan, you think you have all your numbers, and you're looking at, okay, well, how am I going to manage costs now that I'm looking to purchase this plan? There are many different options. There are flexible spending accounts and the health savings accounts that are offered with employer-sponsored plans. Your FSA accounts is a tax advantage savings plan that allows you to set aside a portion of your earnings from each paycheck, and this goes towards any qualified medical or dental expenses. The FSA is offered with your more traditional health plan. Right now, the annual limit is $2,750, and it used to be that this was a true use it or lose it. If you did not spend your funds by the end of the year, you lost that money. Many employers have the option now to amend their plan and allow participants to roll over $500. So that is something that you're going to want to ask about the FSA account when you're considering your contribution, that, if I don't spend this full amount, is there a rollover? The health savings account is also a tax advantaged plan, but this is offered more for the high deductible insurance plans. And you can contribute a little bit more into this than the FSA. Currently, the individual amount is $3,550 and $7,100 for a family. But the difference here is that these funds do roll over and they can accumulate year after year. The big thing to remember here, especially if you're just starting out with an FSA versus an HSA, the flexible spending account, the contribution that you elect, that amount is available to you on day one of the year, whether you have a calendar year plan or just a plan year. That amount is in full there. So if you have a scheduled treatment coming up and you have this deductible to hit, you can plan for that, and that's available for you. If you're already established with a health savings account, that may work for you too. But if you're new and starting out, the difference here with the health savings account is that you can only use what you have actually contributed into the account at that time of service. So, when at the beginning of the year, you have a treatment and you're hitting your deductible, that full amount's not going to be available to you. And another important thing with these savings accounts are the fact that we have to keep in mind that the Affordable Care Act made changes to healthcare, but not tax law. So while you can keep your child on your plan to age 26, if your child is not a full-time student, 19 to age 24, and you can't claim them on your taxes, you also cannot use these funds for that child. Other ways of managing cost, many of the manufacturers have assistance programs. Many providers have some type of hardship or assistance program. You could always check with your infusion provider, the specialty pharmacy, a home health care company, or the infusion center that you go to and ask. They're not always advertised, but you can certainly ask, do you have a program that I can apply for? And many are able to obtain assistance with cost of their treatment that way. So whether you want to be or not, you are responsible and in charge of your health insurance coverage. You really need to be informed. You need to be able to verify coverage details, know what steps to take in resolving issues or getting questions answered. I know it can be a very frustrating process. Nobody wants to say, yay, I have to call the insurance company and ask them a question today, because you're going to be on the phone for 4 hours. But I often have people ask me, can you just make the call? I'm not getting anywhere. And, that's not always an option. It's really important for you to be able to advocate for yourself and know what information and what questions to ask. So when it does come to coverage details, right now I can say you call them, you're going to talk to your basic customer service rep who probably only has a plan summary, and you're looking to get information on how they're covering your immunoglobulin. If you call and just say, well, I take such and such product, they may go straight to a prescription list. It's not listed there. And they say, oh no, it's not covered. That's not where those details are going to be. Many insurers actually have medical policies written in place as for immunoglobulin therapy, that specify the criteria that is required to authorize one for that and what products that they cover. So you want to let them know this is a medical treatment. It requires a prior authorization. Is there somebody in the authorization department I can talk to, or can you escalate this to a manager? Giving them billing codes is going to be very helpful in getting you to the accurate person who can give you the accurate answers. So get your ICD-10 code, that's the D diagnosis code. Whatever product you're on, that is a J code. It's J and 4 digits. Giving that to them, it's going to give you less of a headache and be able to get some answers more quickly. And you want to be proactive. You want to avoid the inevitable insurance issue. It always happens. You don't want to depend just on your physician of having all your records, especially, if you've moved around, if you've been diagnosed for 20, 25 years and you've moved, you have different doctors. You want to have all of those records, particularly from your time of diagnosis. So who made your diagnosis? When were you diagnosed? Do you have the documentation, the lab data that proves your diagnosis? Any ongoing lab data throughout your treatment history that may have showed why certain changes in your treatment plan occurred when it comes to dosing or frequency? All of this information is something that you should have in hand, because no matter what, ongoing, whether you pick a new plan, if you change to a product, you choose a new infusion provider, you're always going to have to get a new authorization, and this information is going to be required. So with that, knowing what is required for prior auths, having that physician statement of medical necessity, having that data from the time that you were diagnosed. You don't want your doctor to just send something in and say, here's the latest labs. They need to know this is when you were diagnosed. This is what your levels were before you even started treatment. History of infections, any antibiotics that have been used, proof of infections, meaning, chest x-ray if you had pneumonia, sputum cultures, were you on prophylactic antibiotics and that didn't work for you? That would be considered a failed therapy and prove or help warrant the need for immunoglobulin treatment. You can also look up medical publications, research articles, or medical reviews on the topic of IG therapy and your specific diagnosis. Hopefully, in getting all of that information out there from the very beginning, stamp approved, no issues, but often we hear about the denial. And many people get frustrated and assume insurance companies, they're just denying it and trying to put off my treatment. And, it may be that they're really not receiving the information that they need. And, we learned a little bit about this when we had a roundtable discussion at AMCP, that's the Academy Managed Care Pharmacy. And we had a meeting with very small, regional health plans, pharmacy benefit managers. And we were talking about, well, what's the issue on your end? And they said, if they're new to our plan and they submit a request for IVIG at this higher dosage, but they're not sending us the treatment history, we may deny it because, they say the dosage should be between this number and this number. So why are they automatically requesting the higher? Well, they don't know. You're new to them and they may not have that information. And it's important to send that treatment history so they know why that request is coming in, not just assuming, well, this is what the doctor wants, but you know, this dosage was bumped up for a reason. So when that denial comes in, payers have to explain to you the reason for the denial. They can't just say it's not medically necessary. They have to give you what is the specific criteria that you did not meet in their medical policy that is forcing them to deny you. Once you know what that specific reason is, it may be just that, you know, they didn't receive that paperwork and your doctor can fax it over and just send another like written letter. If the written appeal doesn't work and you're denied again, your next step is that peer-to-peer review. And this step usually resolves the issue. You just want to make sure, and your doctor wants to make sure that when they make that request to have that peer review, that they are actually speaking to a medical director or a true specialist that understands primary immune deficiency. I've talked to patients and some physicians who have said, you know, I got off the phone and that doctor didn't get it. Your physician has a right to say, you know, this really isn't a true peer-to-peer. I'd like to request somebody else that I can really go through this case with. And hopefully that will go ahead and get you the approval. It does work for many, but I've heard some horror stories where one lady called and said, my doctor called and she got a gynecologist on the phone. They are not going to be able to help you about immunoglobulin therapy. And right away, your doctor needs to say, next, we need to reschedule and I need to speak to a true specialist. If the peer-to-peer does not work, your next step for most plans is going to be an external review. And this is when it's usually filed through your state insurance commissioner and they have an outside company review that for you. Many people don't want to take it to that level, and understandably so sometimes, because once that decision is made by the outside company, then there can be a time period where you can't request for therapy again. So the important thing is with all of this is really following the directions that are provided by the insurance company. There are rules and timelines for this process. So you want to make sure that you're getting the answer to them within the time frame that is designated so that they don't come back and say, well, you didn't send this in time and now, you know, we're not going to review it. And that goes for, you know, the prior authorization as well. Just knowing that timeline process, your doctor may request an expedited review. And if that's the case, they have to make a determination within 72 hours. But typically when you put that request in, they do have up to 30 days to make a decision. So it gives you a good idea of how long it may take. And as you're transitioning to your new plan year, you know, making sure, okay, you know, do I have my infusion at the very end of the year so that if I have to wait for 3 weeks, you know, I don't miss a treatment, or do I have some sub-Q product in stock to continue with infusions? So it's very important to follow those directions and know what they are, and you should get them in writing from the insurer. And with that, I'm going to end here, and I look forward to the Q&A session.
Thank you so much, Nichole. We really appreciate your presentation. To everyone who has submitted their questions, thank you very much. If you have more questions, please continue to send them to IDF Forum. Before we go into our Q&A session, however, I would like to invite Kurt Himes from Grifols for a quick word from our sponsors.
All right. Well, good. I got you off mute there successfully. I'm so happy to be here today. Thank you very much. And thank you for the great presentation on payers. And I think that's so important because, you know, I think all of our lives are really driven and directed by what happens with the insurance companies. So thank you so much for that, Nichole. It was really great. For Grifols, you know, we're a global company that, you know, we've been enhancing the health and well-being for patients around the world since 1909. And so if you're slow at math like me and need a calculator, that's about 111 years, I believe. So we've been around helping patients for a very long time, not to say necessarily always in immunology in our start, but our products, and more of the products what we be concerned about today, are Gaming XC and Zembify. They help to ensure the health and quality of our patients. So for this reason, our safety is a philosophy that goes hand in hand with our commitment to integrity in everything that we do. This is why we have actually increased our plasma donation centers across the United States. As Hector was mentioning, in donating at this point in time, very important for different blood types for plasma. But I think, you know, we only make our products from donated plasma at Grifols sites. So that allows us to inspect that plasma, to know where it comes from, and make sure it's the safest for the patients. And so our patient focus is based on four main pillars: education, advocacy, engagement, and support. And that's why we're here today with the IDF. And we've been a national supporter for a long time, and will continue to be, and just so proud to be here to help you guys out now, in the past, and in the future, especially now as well. As we look at things with COVID-19, we continue to look at how to produce convalescent plasma or gather convalescent plasma to make a hyperimmune product to help out with COVID-19. So I look forward to the patient discussions coming up and how we can help you with our specific products. Thank you very much.
Thank you so much, Kurt, for that. And actually, you brought up a topic that we hope to address at one of our future forums. So you are ahead of the game. Thank you, Kurt. At this time, we will go ahead and go into our Q&A session. But before we go, I'm going to start with a question that came from Carol. And Carol asked, does IDF plan to offer a future forum on Medicare, or is there a contact person at IDF to help know whether to pay for COBRA or change to Medicare while laid off? We will have a forum on Medicare, Carol, later on during the year, and I'll let Nichole kind of handle the second half of your question, but please do know that we do plan on having that forum later on. Please keep an eye out on your emails. So with that, we will go ahead and go into our Q&A session. Nichole, and then the second half of Carol's question was, is there a person to contact at IDF to help know whether to pay for COBRA on change to Medicare while being laid off?
Yes, you can submit questions or call IDF directly. You can call the 800 number, 800-296-4433. You can also go online and click on Ask IDF and submit questions, and we have a team of members who can answer that for you.
Thank you, Nichole. So one of the questions that we got during the forum, my insurance company is not covering my telehealth appointments that are now happening because of COVID, the same as my normal appointments used to be covered. Is there anything I can do to help with this?
I'm really surprised to hear that, as my understanding, particularly, and I would have to look up the specifics of the CARES Act that was passed with that stimulus package, was that there should be coverage for telehealth, and that also with telehealth, there are no co-payments. So I would be contacting the insurer to verify that, but I would first look into the CARES Act to find that language about telehealth.
Thank you, Nichole. Another question, do dependents under age 26 need to be a full-time student in order to be covered by a private insurer?
No, they do not. Regardless of whether they're in school, you don't have to even claim them as dependents on your taxes. They can stay on your plan up until age 26. As I mentioned, the thing to remember is that if you do have a 25 or 26-year-old on your health plan, if you have an FSA or health savings account, they can't use those funds. Those funds don't apply to them because that's a different tax rule.
Thank you. A question from someone in New York. If you don't get employer-sponsored coverage and have to go through the state, then you can get a PPO. But most doctors who deal with IDF and NYC are out of network. Any tips for getting a PPO plan once you don't have employer-sponsored insurance or COBRA anymore?
Yeah, if you're looking at your state marketplace and you're not seeing any of your providers in the network, then you may want to go directly to an insurance company, go to the insurer's website to see what plans they offer, and also maybe work with a broker to see what plans they sell that have those PPO levels and have a wider network.
Thank you. Someone asked if you could please explain what the J code is again. Where do you find that?
The J code is a billing code for the actual product you're on. So if you are on a particular IV product, they bill that product to the insurer with a J code. It's J and then 4 digits. You can always ask your infusion provider, or maybe in the breakout sessions with the manufacturers, what those codes are. But it's a very important code to give to them to get you to the right person to answer questions.
Perfect. And then a follow-up to the question regarding age 26. Does coverage actually go through age 26 or end at 26 in 1 month?
I believe it ends at 26.
Okay, wonderful.
If that's changed, I would have to look into that, but it ends at 26.
Any tips for asking questions about billing when you don't understand a bill?
Oh yeah, that's a good one. It's first, when you're looking, if you're receiving a bill, you want to compare that to your explanation of benefits from your insurance company. Your, insurer should be sending you an explanation of benefits, or, many times you can have an account online and see access to your claims and how they're paid. If you're not sure of the charges, you want to ask, well, what is the cost for this product versus are some of these charges nursing fees, supply fees? It really depends on what you're looking at on the bill, what your question is.
Okay. Another question. Can you explain where a patient could find a billing code for their infusion drug? And can you explain a little bit more what a billing code is?
Okay, so you can find that billing code for your product if you go to any of the manufacturer's websites. If you Google, your product, there's going to be some kind of page with patient support, and many of them have that code listed there. Again, it is a billing code for the product. So when they are billing to the insurance company for your infusion, they are billing the product, they are billing supplies, they may be billing nursing fees. They all have different types of coding. And if you're not, most people are not aware of what those codes are, you can always contact your insurance provider. If you've been with a specialty pharmacy and you're looking to, go to a new plan and you need to ask these questions, just contact the specialty pharmacy and say, can you give me the codes that have been used for my treatment?
My insurance company used to require authorization every year, then it was every 6 months, and now every 3 months, which requires a medical review each time, which many times causes a delay in my treatment. Is there any way I can get this changed?
Most insurers do it every 6 or a year period. Every 3 months is a bit frequent for having, being on a treatment that is ongoing. It shouldn't require a medical review. You could probably request a specified time frame for prior authorization, and you may be able to, that would probably be a good thing if you have nurse case management, to talk to the nurse case manager and say, a lot of times they can talk and do things internally and help you kind of guide and get a resolution to that. But every 3 months really, I don't think is necessary for a medical review. And you kind of should be pushing back on them to give you a longer period for authorization.
Another follow-up to the dependent question. This individual was told that because their spouse was retired, their dependent had to be a full-time student in order for them to be on the insurance. Are they doing something wrong, or is it different if the individual is retired?
It could be different under a retirement plan if they had kind of grandfathered in without knowing plan specifics. Also, you know, is this an employer? Is it a self-funded plan or is it a group health plan? I would need a little bit more details on that. So certainly feel free to send me that question. I can get back to you individually.
Thank you, Nichole. Someone asked if you can go over what is a partial year for insurance instead of standard January to January.
Oh, it's called a plan year. Some go by calendar year. Some people, they might have, you know, their insurance starts July 1st and it changes every July. That's a plan year versus a calendar year. But they're still 12-month periods.
This question, if there were to be a shortage of plasma products, does that impact insurance coverage at all?
It should not impact your coverage. It could a little bit. If there's a shortage, you may have to change products. You may have to change, you know, your infusion provider. If you're with someone and they can't get a certain product and you want to stay on that product and have to go to somebody new, yes, it is going to require a new authorization. But, you know, in that type of situation, that would certainly be something that's, you know, your doctor can request an expedited 72-hour review. You shouldn't have to wait 30 days for making that change.
Thank you. This patient sent in this scenario. In the past week, I've been told that my immunologist is no longer in network. I'm concerned that my IV medicine and required lab work will be also out of network, as you mentioned, Nichole. I've called to ask for a supervisor at the insurance to get the right info, but no one calls me back. Do you have any advice to get the correct person at the insurance firm?
Yeah, this is where it gets tricky. I mean, every time you call, you're going to get a different person. So it's really important when you're making these calls to, one, document who you've spoken to. If you're following up, if you're not hearing back from somebody, to call and, you know, say, I need to speak to a manager. I need to speak to somebody urgently, as, you know, I'm not getting an answer. But the other thing with that is, you know, did your doctor say, yes, I am in network? And then there's the insurance company is saying they're not listed. I don't know if it could be an issue of, you know, the paperwork between the doctor and the insurer, or is it just an issue on the insurance company's end that they don't have them properly listed? It's tricky. You're going to have to be a little forceful in, I need to speak to somebody now. I need to speak to somebody, you know, regarding my health plan. Where can I locate this information, and who is going to get back to me? If they just say, well, we'll get back to you, say, who is going to be getting back to me?
Who determines what is considered medically necessary, and how does that impact my coverage?
Well, I mean, the determination is based off of your diagnosis and what is the standard requirements, you know, to be diagnosed. So if you have CVID, you know, they're going to be looking for those IG levels. They're going to be looking at failure of the vaccine response. They're going to want to see the history of infections. And, you know, this is all coming from the medical community. So that in place, there's a lot of information out there that can give guidelines to providers and even insurers about what IG is, how it relates to PI, what's PI, what's the standard of care. The Quad AI has a really good toolkit, and that is located in our patient insurance center, with information regarding the standard of care for IG and what patient rights are. And that can be information that you can submit to the insurance company as well.
Who do I have to talk to about a denial, my doctor or the insurance company?
Your doctor really should be helping you with that denial process. You should not have to be doing it on your own. Most of the time, sometimes even your infusion provider, they may, a lot of times they're gathering all the paperwork to send it, off for authorization. So if you get a letter of denial, the first thing you want to do is contact your doctor, or if you're working with a specialty pharmacy or home healthcare company or the infusion center, contact them and let them know you've received it, because they're the ones who have the information and will need to look at submitting that. And the doctor may have to write, a little written appeal and send that forward.
Thank you, Nichole. Do marketplace policies usually cover IVAG the same as private employer insurance?
It's all about the plan design. I mean, unless there's a specific exclusion on a policy that says we don't cover immunoglobulin. I mean, I think I've heard of that once. Yes, they'll cover it, but you have to look at that plan and you have to look at those details. Is there a restrictive formulary? Am I limited to product? What's the cost going to be? But it's a medically necessary treatment, and insurance companies cover it.
Is it normal for Gamma Guard to be considered a pharmacy benefit rather than a medical benefit?
I don't want to use the word normal. They can be covered either way. I mean, that's why you want to know when you're verifying the coverage details, whether it falls under the medical benefit or that prescription benefit.
Can you discuss a little bit what's the difference between a pharmacy benefit versus a medical benefit?
Well, when you have pharmacy coverage, you have pharmacy coverage. Like I said, you could have a third-party administrator on that plan. You can have the plan design that's going to have, these tiers. These are the generics you should use. Do you have tiers and increased cost as, you're changing different prescriptions, but, you may have, it could be written completely different than the medical plan. You could have a different deductible amount than your medical plan. Your medical plan you may have co-pays for all your office visits and everything, but then you may have a co-insurance. So it's really verifying between the two. Like I said, all of those out-of-pocket costs, if this is all incorporated in your health plan, are included for that out-of-pocket maximum, but the coverage details can vary amongst those different entities.
When a dependent turns 26, where should they look in order to acquire their own insurance plan?
If they don't have employer-sponsored insurance, it's going to the marketplace or shopping privately with a broker, insurance company online.
What are considered life events that will allow me to change my coverage?
Having a qualifying life event is going to be if you got married, if you had a baby, then you can mid-plan add somebody to your coverage. Or if, for example, if you have a child that's on your plan and they've now gotten a job and they have their own health plan, you can have them removed. Those are the different types of qualifying events.
Okay, so if my spouse were to get a new job and I wanted to go under their health insurance, is that considered a life event that would allow me to change my policy or benefit?
That can be tricky where you can't necessarily, if you get married and you have your own individual health plan, but now you want to go on your spouse certainly can add you to that plan, but whether you can cover it, whether you can cancel your policy, that would be something you'd have to check with your HR department. I don't think that you can cancel your policy mid-year. You would just have dual insurance, and his plan would most likely be secondary to your plan.
And a follow-up question to that, is it possible to use both insurance plans if the spouse were to have insurance and your employer insurance?
Yeah, absolutely. Many people, have a couple of policies. It's determining which one is your primary. Everything will get submitted to that primary plan. If you do have costs remaining, they'll submit it to to your secondary policy. Depending on how that secondary policy is written up, though, it could provide you additional coverage. It may not. If their plan says, we're 80-20 and your first plan already paid 90%, they may not pick up. They're not going to pick up that 10%. So it's all about the details of the coverage.
Perfect. Thank you so much, Nichole. We will end our Q&A session there. However, I did want to let you know that Sheila Dees wanted to tell you, thanks, Nichole, for all your help and advice. It's great to have you in our corner. I can certainly say that we are very fortunate to have you at IDF.
Oh, thank you, Sheila. Nice to hear from you.
If you do have more questions, we do encourage you to submit them via Ask IDF. We have dedicated staff to help you. Nichole is usually one of the ones who helps with answering all of, a lot of these questions. I don't know if you want to talk a little bit about Ask IDF, Nichole?
Yeah. Ask IDF, you can submit any question through, whether you're, newly diagnosed, you have questions about your diagnosis, about treatment, you have a child that may be having a school issue, and they have a PI, employment issues, insurance, education, and insurance type issues, peer support. You can submit anything through that Ask IDF portal, and somebody will get back to you.
Thank you. And I'm sorry, we had one last question, but this one's actually, it is important. Is PI considered a disability?
It can be for some people, yes. Depending on the severity of your disease, what your job is, is it something that puts you at risk? Are you more prone to illness? Do you have organ or tissue damage due to chronic infections? It's something to discuss with your physician, but there are many people that are able to get disability for PI, and there's actually a great organization that has a program that assists with that. Patient Services Incorporated, PSI. They have what's called the Access Program, and they can help you kind of navigate those complex mazes of federal and state entitlement programs, and let you know whether what you would qualify for, SSI or SSD.
Awesome. Thank you so much, Nichole. And as a final reminder, we also have more virtual forums. You can look online, another great way to submit your questions. With that, we will close our Q&A. Thank you again, Nichole. We appreciate having you here. It's always a pleasure. For those of you who are interested, Nichole will be back with us later on this year again for another forum where we'll discuss Medicare. At this time, I would like to invite Kelly Gertz from CSL Behring for a quick word from our sponsor.
Thank you. And before starting, Nichole, yes, IDF is lucky to have you. What a great presentation. I learned so much. So thank you for that. Also to the IDF, thank you so much for allowing CSL Behring to join these forums. What a challenging time. I think none of us could have ever dreamt this could happen to us. But my name is Kelly Gertz. I'm an area manager with CSL Behring. And on behalf of all of CSL Behring, I want the patients and the IDF to know that we support you. Our products are Hizentra and Privigen. And I know during this time, I've received a couple phone calls today from nurses that are saying, I know you're going to be on there tonight. Can you please go over your support programs? So please join us after this in the forums. We're going to go over IGIQ, which is our hub, and talk also about Hizentra.com, but most important, the copay programs, the assurance programs, our voice-to-voice advocates who are always there to listen or receive a phone call from you, and our free sample trial program. So please stay on. We've also developed patient webinars that you can join from your own home, and I'll be sharing all those dates that you guys can join. So like I said, thank you again, IDF, and we will get through this all together and come out stronger. I know that at the end of it. So thank you.
Thank you, Kelly. We really appreciate that. At this time, we are now going to go into a little bit of a presentation about IDF and some of our resources. So for those of you who have not had the chance, please make sure that you check out our online resources. We have a number of items there for you: IDF Friends, Facebook, social media, Twitter. We have online publications that you are able to download, such as our Patient and Family Handbook. You can find out about upcoming events, resources, information about PI, materials for different ages. We have materials for adults, for children. Maybe you're interested in communicating with teachers. We have publications for you all available as PDFs. So please make sure that you connect with us either through social media, that you create a portal account. This is the way that you will also submit your questions for Ask IDF. If you are interested in finding a physician in your area, we have our IDF Physician Finder. It helps you find physicians who treat PI within the area. So please make sure that you take advantage of that. That is there for you. We also encourage you to utilize one of our support programs. So as we said, IDF is a very community-powered organization, and we really believe that it is our community that will help us get through our journey together. And so we provide our IDF peer support programs, Get Connected groups, which are offered nationally and virtually now. It's a great way to connect with others, to ask questions and see how other people, where they are on their journey. We have our IDF Facebook groups, our IDF Friends. Again, you can find out more information about these online. So please make sure that you take advantage of this. We know during COVID-19 how difficult it is not being able to meet in person with others. And so we want to make sure that you are connected with others as much as possible. Again, a special thank you to our sponsors. We truly appreciate them. It's through their support that we are able to offer these wonderful programs. We are able to serve you and create these forums that are meant to provide you, again, with the tools to be your own advocate. As Nichole said, it is about you being able to have the tools that you need to stand up for yourself and go through your journey. Thank you so much for participating. To everyone, thank you so much for being here. We truly appreciate having you here with us during our forums. We encourage you to continue coming to these. If you have any questions, feel free to reach out to us. I did forgot to mention the chat is now open to everyone, so please feel free to say goodbye to everyone. We appreciate having you here. Thank you, Nichole, again for your presentation. It was certainly very helpful. And with that, we will end our session for today. Thank you to our sponsors. Thank you to you. We love serving you, and we will see you next time.